Hello, I'm Phil Durham, and today I'd like to describe how we can use acoustic angiography to visualize perfusion changes following therapeutic ultrasound with phase change contrast agents. Phase change contrast agents are acoustically active nanoparticles that can be made by condensing the gas core of a conventional lipid shell microbubble into a liquid by decreasing the temperature and increasing the pressure. They will remain stable in this condensed state until sufficient ultrasound pressure is applied, which vaporizes the liquid core back into a gas, generating a microbubble. As with conventional microbubbles, there are many potential therapeutic applications for phase change contrast agents. Due to their small size and increased circulation lifetime, phase change contrast agents may have therapeutic uses beyond what can be achieved with conventional microbubbles. Acoustic angiography is a special type of contrast imaging which utilizes a dual frequency approach to eliminate the ultrasound signal from tissue and isolate the microbubble signal. As depicted in the graph, receiving at frequencies much higher than transmission allows the localization of the broadband microbubble response while significantly reducing fundamental and harmonic signals associated with tissue. By collecting many frames, we can build detailed vascular maps indicative of perfusion, such as seen in the mouse skull and brain presented on the right. It's been observed that therapeutic ultrasound combined with microbubbles to target an area for drug delivery can sometimes result in a decreased blood flow to the target region immediately following treatment. As acoustic angiography is a visualization of vascular perfusion, are we able to use acoustic angiography to determine a change from before treatment to after treatment? To evaluate this, we used a focused ultrasound transducer and phase change contrast agents with ultrasound parameters that have been used previously to enhance local drug delivery. Using a subcutaneous model of pancreatic cancer in mice, we begin by capturing a perfusion baseline of the tumor with acoustic angiography. After the microbubbles have cleared, we then position the animal on the therapeutic platform and administered 50 microliters of decafluorobutane core phase change contrast agents and initiated 5 minutes of treatment, with each pulse beginning with 2 higher pressure cycles to induce vaporization, followed by moderate pressure cycles. After treatment, the animals were positioned back onto the imaging platform, microbubbles were infused, and a second acoustic angiography scan was acquired. If we look at the resulting angiographs side by side, you can see some perfusion differences from before and after. If I pause this, you can see here the tumor appears more perfused on the before image than in the after image. And further, if you visualize these in 3 dimensions, you can see more fine details, such as the apparent decrease in perfusion as seen in this vessel that feeds across the surface of the tumor. And in the after image, the signal from this vessel is considerably reduced. If you render these as 3-dimensional objects, the picture is slightly more clear. What we can do from here is we can capture the volumetric B-mode scan, align it with our acoustic angiography image, and we can draw a region of interest around this tumor in 3 dimensions, and they can quantify the pixel intensity resulting from inside this region of interest. We then quantify the number of pixels in that region of interest that are above a threshold value. The percentage of pixels in that region that are above that value is our percent positivity. And you can see here that before and after treatment there is a considerable, though not significant, decrease in perfusion as measured by acoustic angiography following therapeutic ultrasound with phase change contrast agents. In summary, acoustic angiography is a non-invasive tool that can help to visualize vascular perfusion. Phase change contrast agents combined with therapeutic ultrasound can be used for targeted drug delivery, and perfusion changes relating to therapy can be visualized after treatment using acoustic angiography. Thank you all for your attention.